A COVID-19 surge is catastrophic for underprepared communities. Lacking education, preventive measures, PPEs, and overcrowding, the virus will aggressively spread, eventually overwhelming healthcare infrastructure in nations such as Nigeria, Nigeria's 5 climate zones, and diverse industrial and agricultural economy with marginalized pockets of poverty challenge us to innovate on behalf of a community planner who we imagine have internet connectivity and the ability to assemble a task force of church, school, business, tribal, and other community leaders to develop and implement a plan of action. Our product enables this task force to collaborate with medical professionals to create a data-driven, targeted plan of action to mitigate spread. Our users will participate in all 3 action phases: community preparation, personal protection, and protecting your community. Early detection is key, and our innovation is to define 3 factors that drive protocols. Risk is our likelihood of infection. Currently, vulnerability is likelihood of future infection, and susceptibility is the likelihood of infection leading to a serious condition. The task force will create culturally unique surveys and feasible protocols, as well as taking preventive steps to reduce healthcare overload by pre-registration and enlisting able bodies to provide non-emergency services. Our innovation is to classify individuals, tagging urgent status, explaining immediate protocols delivered in appropriate format, and providing resources for assuring compliance. Engaging leaders with established trust will minimize survey time, pre-hand ID future hotspots, maximize reach and accuracy, and produce timely, actionable data, enabling forecasts of bed, ICU, and ventilator shortages, best locations for makeshift facilities, and initiating non-emergency care. Our impact to decision makers is the ease of creating a 5-question survey of symptoms and potential exposure that identifies 5 risk groups, together with a vulnerability score and susceptibility score based on individual behavior, demographic, and health, to yield a feasible self-care protocol suite. Our implementation is streamlined and intuitive. The task force users are guided with dialogue screens populated by an expert system with facts derived from peer-reviewed journals. Community members benefit from instructional media deemed necessary and sufficient to fulfill compliance. Self-care involves self-monitoring, which can be high-tech, heuristic, or include field evaluations. Our innovation includes recommendations for sanitizing based on available resources. The impact is that diverse needs are met by a single tool. Those with shopping and septic can use brand products, and those without water or electricity can use sun and time. Tutorials for creating kits and how-tos will be generated for each level. To illustrate the impact of non-emergency care, a pregnant woman can recruit a partner, thus reducing her exposure to hospitals while increasing the likelihood of a healthy delivery on this continent with high maternal morbidity. Our business plan is short and sweet. Our app tools enables a surge preparation task force to develop a plan of action, create targeted survey to identify risk, vulnerability, and susceptibility for community members, analytics to predict shortages, provide protocols and appropriate resources to ensure compliance, nowcast and forecast outbreaks, and provide tools to mitigate by pre-positioning resources and reducing tasks of healthcare workers on the job and in their homes. In summary, our impact is to spread love, not COVID-19, by engaging the community with easy-to-use tools for creating a targeted action plan to mitigate the surge. This is our team. Thank you for listening.